Each year, the State of Vermont's Children Year in Review contains a data spotlight. This year, we are focusing on Vermont's child welfare system because it is in crisis. The 2024 Federal Child and Family Services Review, or CFSR, found that only 1 out of 36 outcomes and factors was rated as a strength. Vermont's child welfare system is housed in the Family Services Division, part of the Department for Children and Families within the Agency of Human Services. And we will be referring to this division as DCF FSD. This data spotlight aims to spark conversation about our state's child welfare system. This is not a comprehensive review of the system, but instead focuses on several key factors, a few of which we will cover now. Vermont statute mandates that an individual working with children and families, quote, who reasonably suspects abuse or neglect of a child, end quote, must report the case to the Child Abuse and Neglect Hotline. The list of individuals and the criteria are similar to other states. However, as can be seen here, Vermont's rate of intakes has been between 2.5 and 3 times higher than the national average, while the actual rate of child victimization consistently falls below the national average. The intent of the law is to protect children from abuse and neglect. However, there is no evidence that these laws are protecting children. In fact, there is evidence that the laws are deterring families in need of support from seeking resources to address their challenges because of this culture of surveillance. The Vermont Child Welfare Training Partnership and DCF FSD are revising the required training for mandated reporters. As part of the revision, mandated reporters will be encouraged to reframe their role to mandated supporters. To that end, reporting to the child welfare intake line should be considered in the context of the multiple resources that can support the safety and well-being of children. The number for that child protection hotline is 800-649-5285. DCF FSD holds many roles and engages with families in multiple ways, including out-of-home protective custody, in which a child is placed with a relative or foster family. On September 30th, there were 907 children and youth in out-of-home protective custody, 449 of whom were under the age of 9. This number has been falling after a sharp and sustained increase after the deaths of 2 young children in 2014 and subsequent policy and practice changes. In this past year, Black children and youth accounted for 2.1% of the population in Vermont under 19, but entered state custody at a rate of 2.8%. Black or African American children also have the highest rate of placement instability, or moves, per 1,000 days. Like many direct service providers and human services sectors, high vacancy and turnover rates among family services workers impacts the overall well-being of the system and the individuals that it serves. As can be seen here, vacancy and turnover rates have increased since the pandemic, with an 11.4% vacancy rate and a 16.1% turnover rate in 2024. In addition to the creation of 2 new positions, the Family Services Division was just selected to receive long-term intensive technical assistance from the Federal Quality Improvement Center for Workforce Analytics to identify Vermont's specific workforce challenges and support the implementation of strategies to strengthen the workforce. Last but not least, Vermont's antiquated data system was built in 1983, one of the oldest in the country. The shortcomings of the system are directly responsible for preventing Vermont from accessing all federally available dollars and result in increased federal financial penalties annually. While $7.8 million has been allocated to a new comprehensive child welfare information system, or CWIS, even with a 50% federal match, we are still well below the estimated $40 to $50 million necessary for a new data system. Vermont has made progress through establishing the Office of the Child, Youth, and Family Advocate, allocating some funding to a new data system, carrying out diligent recruitment and retention efforts for foster families, and providing workforce supports and investments. But there is significant work remaining. Our 2025 policy recommendations for some of that work include securing sufficient funding for a new CWIS and utilizing existing reports, strategies, and improvement plans to make data-informed programming and financing decisions.